Vital signs are the language of the body, whispering crucial information about a patient's health. These physiological measurements provide a window into the functioning of vital organs and systems. Nurses, as vigilant guardians of patient well-being, rely heavily on vital signs to assess, diagnose, and monitor their patients' conditions. Understanding the significance of each vital sign and the implications of their fluctuations is paramount in delivering effective and timely nursing care. Monitoring vital signs is not merely a routine task, but a critical aspect of nursing practice that directly impacts patient outcomes. By recognizing subtle changes in these vital parameters, nurses can detect early warning signs of deterioration and initiate prompt interventions. From monitoring the effectiveness of medications to identifying potential complications, vital signs provide invaluable insights that guide nursing care and ensure patient safety. This essay delves into the essential role of nurses in monitoring vital signs, exploring the significance of each measurement and its impact on patient care. It will also highlight the challenges and techniques involved in accurate vital signs monitoring, emphasizing the importance of precision and vigilance in this fundamental aspect of nursing practice. Nurses are equipped with a toolkit of 5 vital signs: temperature, pulse, respiration rate, blood pressure, and oxygen saturation, to assess a patient's physiological status. Each vital sign provides unique information about the functioning of different body systems, and together they paint a comprehensive picture of the patient's overall health. Temperature, a measure of the body's internal heat, is a key indicator of metabolic activity and the body's response to infection or inflammation. Nurses routinely monitor temperature using various methods including oral, axillary, rectal, tympanic, and temporal artery thermometers. An elevated temperature or fever can signal infection, while a low temperature or hypothermia can indicate poor circulation or exposure to cold. The pulse, felt as a rhythmic throbbing in the arteries, reflects the heart rate, or the number of times the heart beats per minute. By palpating arteries, such as the radial artery at the wrist or the carotid artery in the neck, nurses assess not only the heart rate, but also the...
This video was proudly sponsored by Gologin, GoLogin, the best browser for multi-accounting. That was a brief moment, ladies and gentlemen. Let's get back to our video.
The rhythm and strength of the pulse. A rapid pulse or tachycardia can indicate stress, anxiety, or underlying medical conditions, while a slow pulse or bradycardia can be a sign of heart problems or electrolyte imbalances. Respiration rate, the number of breaths a person takes per minute, provides valuable insights into the functioning of the respiratory system. Nurses observe the rise and fall of the chest or use a stethoscope to listen to breath sounds, noting the rate, depth, and ease of breathing. An increased respiration rate or tachypnea can be a sign of respiratory distress, pain, or anxiety, while a decreased respiration rate or bradypnea may indicate respiratory depression or neurological problems. Accurate and timely vital signs monitoring is crucial for optimizing patient outcomes. By recognizing subtle changes in these vital parameters, nurses can detect early warning signs of deterioration, initiate prompt interventions, and prevent potentially life-threatening complications. For instance, a patient admitted with pneumonia may initially present with a fever, cough, and shortness of breath. Regular monitoring of their vital signs, particularly their temperature, respiration rate, and oxygen saturation, can help nurses track the effectiveness of antibiotics and identify any signs of worsening infection. A sudden spike in temperature, an increase in respiration rate, or a drop in oxygen saturation could indicate a worsening infection or the development of complications, prompting the need for further medical intervention. In another scenario, a patient recovering from surgery may experience a drop in blood pressure due to blood loss or dehydration. Regular blood pressure monitoring allows nurses to detect this early and administer fluids or medications as needed, preventing a dangerous drop in blood pressure that could lead to shock. Moreover, vital signs monitoring helps assess the effectiveness of pain management strategies. A patient experiencing severe pain may exhibit an elevated heart rate and respiration rate. By monitoring these vital signs, nurses can evaluate the effectiveness of pain medications and adjust the treatment plan as necessary. While vital signs monitoring is a fundamental aspect of nursing care, obtaining accurate readings can be challenging, requiring both skill and vigilance. Several factors can influence the accuracy of vital signs measurements. And nurses need to be aware of potential sources of error to ensure reliable readings. One common challenge is patient movement. Restlessness, tremors, or even slight movements during measurement can affect the accuracy of readings, particularly blood pressure and pulse rate. Nurses should ensure that the patient is comfortable and relaxed before taking measurements, and, if necessary, repeat the measurement when the patient is calm. Another challenge is improper technique. Incorrect placement of the blood pressure cuff, use of an inappropriate cuff size, or failure to inflate the cuff to the correct pressure can all lead to inaccurate readings. Nurses must be proficient in using various types of equipment, including manual and automated blood pressure cuffs, thermometers, and pulse oximeters. Regular calibration of equipment is essential to ensure accuracy. Furthermore, patient factors such as obesity, irregular heart rhythms, and peripheral vascular disease can pose challenges to accurate vital signs measurement. Nurses need to be aware of these conditions and adapt their techniques accordingly, such as using a larger blood pressure cuff for obese patients or palpating the brachial artery for pulse measurement in patients with weak radial pulses.